you confused by deductibles in health insurance in the US? Are you interested in understanding whether or not you should be choosing a high deductible or a low deductible? Or are you someone in healthcare, in the business of healthcare, that is trying to help someone navigate how to interpret whether an insurance company is even going to pay when the patient has a high deductible? If so, then today's video could be for you. Okay, so many of our plans here in the US have high deductibles. I understand how confusing it can be whether or not your insurance company is going to pay anything towards your care. Whether you're a patient or a person working in the provider side in the business of healthcare or the front end, I understand that it can be very confusing when you're looking at these high deductibles to know whether or not you should collect from your patient. So really quick, I'm going to just briefly cover what is a deductible, that we have a lot of other videos that go a bit more in depth. So deductible is an amount that a patient would need to pay out of pocket before the insurance carrier would actually make a payment. So in this day and age, we see our deductibles considered high, which is really upwards of about $2,000 in a year. So annual deductibles are typically paid once a year, need to be paid at least once a year. When we see deductibles in the tens of thousands and $5,000, $10,000, we could maybe consider that plan a catastrophic plan, which means that unless there is a catastrophe, something bad, you would really never meet that deductible amount, which we hope you don't have a catastrophe in your care. A lot of the times we would recommend that if you are someone who is in good health in this day, or someone who is somewhat young and in good health, then you might consider a plan that has a super high deductible because you might have some savings. You can use that money towards something else. If you have a lower deductible, oftentimes you will find that the insurance company will charge you more money to be able to compensate or cover the fact that they will now be considering, they would likely be paying something sooner because you are only paying a certain portion. So deductible amounts are essentially a way for you to have a bit of a shared cost model with the insurance carriers. So not our favorite model, of course, but it's one that works, I guess, in some kind of ways. All right, so what really constitutes a high deductible? So that's really a relative term, right? Because we would consider $2,000 and upwards a high deductible. However, if you are a medical practice that is treating patients for more expensive services, upwards of $500 or $2,000 per service, then you may not think that a $2,000 deductible is very high. However, if you are someone who has a procedure that's being provided or a service that's being done with your patient and it's only $60 that is going to be billed to insurance, then you would think that anything upwards of $2,000 is high. So we would just go for the general statement to say that anything above $2,000 is kind of high. So when it comes to high deductibles, it's really important to understand whether or not a patient is prepared to cover their services, because they will end up having a liability. So it's quite important in healthcare in the US that we communicate to our patients that they have these types of high deductible plans, because if you aren't going to collect from them up front, then you're probably going to be sending them a statement in the mail, and we don't want anyone surprised when they get their statements in the mail. So make sure you communicate these to your patients, as well as letting them know maybe an estimation of what it might cost for said service, because when they receive the statement in the mail, it's going to come with, if you're in network, with the allowed amount or the amount that the insurance company says is okay to pay towards the claim, and that will be the amount that they will need to owe. If you are in network, then meaning you have a contract with said insurance company as a provider's office, then you will not be billing your patient this amount that shows up on your fee list. Instead, you're going to go according to the contracted rate, or what we call the allowed amount, because it's the contracted rate plus whatever the patient's plan allows. All right, so that is it for this video. If you have more questions about deductibles, stay tuned. We have a lot of content coming down the pike. I would love to know where you might be confused in this area of healthcare, so go ahead and pop a comment below and let me know how that feels for you. All right, thank you so much for being here. That video, we covered deductibles. In our next videos, we're going to continue this conversation about deductibles, so be sure to let us know where you are and what you might be struggling with. If you are brand new here, then you want to consider subscribing and liking this video, making sure you let us know that you are interested in additional content. You want to also ring that notification bell, because we go live pretty regularly here on this channel. You may even be interested in joining us as a member. Our memberships are quite low, and it gives you an opportunity for some exclusive content, both lives and some resources that we have available here on the channel. Thank you so much, and I'll see you in the next video.